of the rule for LD. That occurred in 2006. Autism spectrum disorder, again, as I mentioned earlier, you're all pretty aware of the increasing number. We've had a fairly dramatic increase. I can go back to 1993 when we had 395 students eligible with that autism eligibility, and we are up at 3,175 as of last year. So why? Well, way more awareness level of autism and its spectrum. And the Michigan rule also changed definition of autism in 2002 as well, that broadened the spectrum to recognize students on what we call the higher end of the spectrum, those youngsters that you might know as having a diagnosis of Asperger's syndrome, where they have very good cognitive capacity, they have good communication, or they have communication skills, they are verbal, mild behaviors. We fondly, and I know I'm being recorded here, describe those youngsters as the funny little kids. They get along, but they have some difficulties. And, you know, I can do you a week on autism because that's one of my areas of specialty, characteristics and such. And but the increase is related to a variety of factors. Here in Wayne County, we've always been cognizant of autism. We did operate and identify children under that category back in the early, before even 1990, which was very unusual anywhere in the country, clearly in Michigan. So we have a long history of awareness and service to students specifically with autism. But the identification information, the evaluation tools that we have available now are so much more advanced. They really help us when doing evaluations to tease out, if you will, those specific areas and characteristics that truly represent autism versus, say, speech and language impairment or a cognitive deficit. So that's an area that we continue to work on to improve our programming. Emotional impairment, fairly steady, but just a little bit of a decrease in terms of the numbers of students. Now this other health impaired, this is somewhat of an increase, but not dramatic. These are students who fall in a myriad of categories. They can be students with attention deficit disorder, with or without hyperactivity, students with significant, from that to all the way on the other end with significant medical conditions, health impairments that place them sometimes at risk for death on a daily basis. So it's a large spectrum, but it's fairly specific in needing medical diagnosis to support the condition. Children with heart conditions, even some children with severe seizure disorders or severe diabetic conditions may or may not meet the criteria for this eligibility. The increase in juvenile diabetes is amazing over the last some years. Not all children with a diagnosis of a diabetic condition rise to the level of being considered disabled or handicapped. The it's always how that deficit impacts their ability to function on a day-to-day basis. Sometimes if all you need is to make sure you have a plan to allow the child to do their blood screening checks and someone to assist with the administration of the medications, however the child is getting them. And that's it. They're good to go. They don't need a lot of interventions. And then we have some very young children whose conditions are unstable, who don't have the capacity to really know and be aware of when their levels drop. And those children, because the risk rate rises, they may need more support and may rise to an eligibility level. The other categories we consider low incidence, and we're going to look at that a little bit more because the two differences are low incidence in the population versus high incidence. So you saw that our specific learning disability category was our largest, 35%. There is a much higher incidence in the total population versus some of these categories here, and our you saw was about 1% for our physically impaired, less than 1%. And what is this attributed to? Better prenatal awareness and care. Some of the factors that impacted babies at birth are no longer present for most of our population. I'm sure some of you see poverty and educational levels that you would disagree with me because we have in this country not wiped this out. But over the last probably 20 years, we have improved dramatically awareness of prenatal care and availability of prenatal care. And that's certainly one, particularly the vision, the hearing, and some of those physical anomalies that occurred, in the 70s with the drugs that were being administered, lots of different things that we've improved on. The SXI stands for severe multiple impairments, and each of these categories has a separate rule that defines it. The multipleness means the child has a cognitive deficit in the moderate or severe range, along with one or more of the sensory areas, physical, vision, or hearing. And so that team has to look at all of the issues related to that youngster. And when there is cognitive deficit plus one or more of these, they may more appropriately determine that child's multiply impaired because all of those impairments significantly interfere with their ability to learn. We have two early childhood categories. One is called early childhood services because they are our babies, our birth through 3-year-olds. And then we have early childhood programming, but all of them still fall in the low incidence area just because there are less birth through 3-year-olds than there are 3 through 26-year-olds. Break? How perfect, how perfect. You'd think I rehearsed this. Okay. And I've referenced IDEA and the full title, Individuals with Disabilities Education Act. That's the federal law. It has been, it was originally approved in 1976 under a different title. That was the Education of All Handicapped Children's Act. Same law. The Congress reauthorizes most laws every 5 years. And sometimes they don't get to the task during that 5th year, and so the current law gets reauthorized temporarily and it carries over. This typically happens when there are other things happening in Congress that take up their time, and it doesn't get brought forth. The primary 2 things that a reauthorization does is it, of course, reauthorizes a law with perhaps changes or perhaps not, but with the federal law, it also reauthorizes funding. There are federal funds attached to this IDEA law. What does that mean for Michigan? Generally, the IDEA is authorized at such a level, comes to the state, state distributes it to counties, RISAs or ISDs, distribute those federal funds out to school districts and public school academies. Basically, IDEA is funding very much less. The original promise was that the federal law would support special education at 70%. It's never reached that funding level, ever, even its beginning. Maybe 35 to 40% has been a high. So when you think about distribution, that provides not very close to what's needed to serve a whole child. So that's the law currently was I think reauthorized in 2006. The regs came out. It would be or would have been up for reauthorization last year. There has been no finalization on that reauthorization yet. So we'll watch for what happens. Probably nothing in the next few months, and then we'll see what will happen after the election. The MARS, or Michigan Administrative Rules for Special Education, is Michigan's rule. It really is originally PA, or Public Act 118. It's been renamed any number of times, and we just had a revision become implemented in October 2011. It's not perfect, but one of the primary things that the State Department did was to try to bring regulations more in line with the federal regs. This is when some of that controversy or conversation rose up about our age range, because that's a significant difference. We chose to keep 0 to 3, 21 to 26 in our rule. And there are a few other areas, some differences in some of the timelines. None of them are extreme. The other federal, and this is a federal law, we call it FERPA. You may have heard of that. It's the Family Educational Rights and Privacy Act, and this law governs everything related to educational rights, records, distribution of information, use of information, and we're not going to spend really any time on that one. All of these laws, just Google them. I've been trying all morning to pull up the Michigan document for you so we could look at some of the rules, but there's a problem with opening it up. We can't seem to open it up. So I'm going to just take you to the websites, and then you'll see how you can get to it. Those are the 3 regs that we follow. This is, just so you can see, this is what that IDEA, the cover, and these are, these are documents like this with teeny, teeny, tiny print. So our job at Wayne-Risa for our districts is to be very familiar with this and be able to go to a particular, okay, that's this rule, and we have our rule books all dog-eared and yellow, tab.